Hi, so today we're going to talk about breast cancer. More specifically, we're going to talk about the difference between breast cancer and metastatic breast cancer, which are things that I don't know anything about. So we have Charlie here to inform us today. And so what is the difference between breast cancer and metastatic breast cancer?
Okay, so breast cancer is where you have a cancer in the breast. It's called primary breast cancer. Breast cancer can be cured via chemotherapy, surgery, many options. Once all that is done and you are declared cancer free, that's your breast cancer journey over. You have checks yearly. Metastatic breast cancer is where the breast cancer travels from the breast to either organs or bones, such as liver, lungs, brain. Metastatic breast cancer is exactly the same cancer as breast, so it isn't liver cancer or lung cancer. It's not a different cancer. It is exactly the same as a primary tumour, only those cells have broken off and created tumours within organs and bone. Once that happens, it's incurable, but it is manageable. There is treatments, there is hormone treatments, there is tablets, there is chemotherapy. It is containable and manageable, but it is essentially terminal. So people with metastatic breast cancer, it will kill them. It will, the reason for that person's death will be the tumours cause organ failure in the end, whereas primary breast cancer, people don't die from breast cancer, people die from metastatic breast cancer.
Okay, so and for the benefit of the audience who may not have caught on yet, the kind of cancer that you have is metastatic breast cancer.
Yeah, so my breast cancer is in the liver, so I have metastatic breast cancer with liver mets is what they call it. So I have tumours, breast cancer tumours in my liver.
And you're about halfway through treatment?
So I've had 4 cycles of chemotherapy. I have 2 cycles left, and then I have a lifetime of drugs. So treatment is ongoing forever with me. So primary treatment has an end. My treatment has no end.
Okay. And in terms of kind of how people react to you and talk to you as you are having your treatment and going through treatment, how is that kind of different to how people normally treat you, how people normally talk to you? What's going on with kind of social pressures and stuff like that?
So I suddenly become Wonder Woman. Right. So everybody is very much, the word fight is used. You can fight this, you can battle this. I get a lot of, if anyone can beat this, Charlie, you can.
Okay.
Which is high pressure because I physically can't.
Because nobody can beat this.
No.
So you can't go, woo, here's my cake.
It's physically unbeatable. But there is a lot of expectation, I feel, as a person with metastatic breast cancer, to beat it, to overcome something that is physically impossible.
Because that's the language that we use when we talk about illness all the time, is people battling as though you've got kind of an equal chance with the illness, and if you just work hard enough.
But nobody enters a fight that they can't win.
No.
Which I can't win. So I'm not fighting breast cancer, I'm living with it.
Yeah.
I'm also not dying of breast cancer, I'm living with it. But people suddenly sort of feel very awkward around me. And it becomes very much sort of, how are you? Nobody sort of treats me as me anymore. I'm not Charlie, I'm now Cancer Charlie. So I feel like I have to step out of my front door with my cape on and my mask on and be very much, everything is brilliant. I'm absolutely fine, because nobody wants to hear the real answers of emotionally what's going on, or physically what the chemotherapy is doing to my body when I have it.
Yeah.
So when I have to take a deep breath every time I leave the house, not because I don't want to talk about cancer, because it's part of my daily life, I'm happy to talk about it, but actually people don't want to talk about the cancer, but feel that they have to address me because I have cancer, so I have to make them feel better.
They kind of want the positive spin on how it's all
Yes.
going. So not the reality of what you're actually going through with your treatment, but to hear how well you're doing in that fight. It's that
feel
kind of thing.
and I kind of feel like I have to protect other people from it. From the reality of what it is.
Right.
And obviously nobody intends to upset me when I leave the house. Nobody realises that they're putting pressure on somebody with...
Yeah, people are trying to be nice and
Absolutely,
encouraging and positive.
absolutely. But because there is a lack of awareness on the difference between breast cancer and metastatic breast cancer, people don't understand. So lack of knowledge creates awkwardness, and with awkwardness comes words and sentences that foot and mouth disease basically is what happens. And that's not because people are rude, and it's not because people are ignorant, it's because cancer awareness actually doesn't give any information. So which then creates a situation where I then end up feeling like I have to pretend that everything is absolutely fine and I'm in full control of a situation I have no control over.
Okay, that makes perfect sense.
I'm glad.
Right, so in terms of how you even discovered that you had cancer in the first place, how was that diagnosis made? What actually happened?
Okay, so for me personally, I found a lump in my right breast, but we're going right back to June of 2017.
Okay, and were you doing what we're all told to check your breast? Because I don't even know how to do that, even though I've looked at videos and things.
Yeah.
So you weren't not looking.
Not at all.
Right.
No. It was simply a case of I was laid in bed with my hand on my boob because it was comfortable, and I've breastfed 3 children, so they're not voluptuous breasts.
Yep.
So I just happened to notice that I had a pea-sized hard lump. So which then I had a bit of a feel of, asked my husband to have a feel, and he was like, no, that's definitely like a lump, as opposed to sort of premenstrual lumpy boobs, which we all get.
So you just knew that it felt...
It just wasn't
different.
quite right.
Okay.
So I went to my local GP, and she had a feel of it, and she agreed that it didn't feel right. But she did say to me, it's probably nothing because you're only 31, so it's probably nothing, but we'll send you to have it checked just in case, as we do with all lumps. Absolutely fine. So I went on what they call fast track 2-week emergency waiting list. So within 2 weeks, went to the Churchill Hospital, to their cancer and haematology centre, and had an appointment. Now, because I'm at the time was 31, their procedure is to scan using an ultrasound like you do for pregnancy. And if that ultrasound shows any abnormalities, then they look at further testing.
So they don't do a biopsy on a lump at this point in time?
No.
Right.
But if you are 40 and over, it is standard procedure to do a ultrasound, a biopsy and a mammogram.
Right.
So me at 31, I go in, I have the scan. And on my scan at the time, there was no abnormalities shown, which is actually not uncommon because 50% of early breast cancer shows as normal on an ultrasound scan.
Okay, so that means they are, okay, so you've just got a lump, but everything's fine.
Yes. So my personal experience actually was not very pleasant either, because the lady who scanned me was quite flippant with me, and said to me, well, it's just normal breast tissue. You're 31, it's normal breast tissue, what did you expect?
Okay.
So I actually left feeling like I shouldn't have made a fuss and gone in the first place.
Because you're wasting the time of somebody who might have cancer.
Exactly, and because I was only 31, so it was quite clearly just breast tissue.
Yeah.
Was how I felt when I left.
Okay.
So off we go, and then April of this year...
so this was last June, July. June.
So that was last June, 2017.
And everything's fine. You're not worried.
Told me it was absolutely fine.
Okay. Yeah.
And I left. That was all the tests that was done. There was no checkup test. There was nothing. So June of this year, in the shower.
April.
No, June of this year.
Okay.
April of last year.
April of last year.
June of this year.
Sorry.
Beginning of June this year. I was in the shower and realised that actually the lump was significantly bigger. And I hadn't noticed prior to June that it had changed and had got bigger. But because I was told it was normal, I just didn't acknowledge that it had got bigger because I'd already been told that the lump was normal. While in the shower, I then realised that I had actually had a lump in my armpit, which kind of was a red flag for me because I thought, well, that's not good. This lump's got bigger, lump in my armpit. So I went back to the GP, which I wouldn't have done if I hadn't found the lump in the armpit. Went back to my GP, who referred me back up to the hospital, same scenario. Went back up to the hospital, it was the same lady that scanned me. So I looked at my husband and I was like, oh no. And this time, the second she started the ultrasound, her whole persona was totally different. So I knew something wasn't right. She was at her bedside manner was suddenly quite nice to me. And so she said to me, I'm just going to do a quick biopsy. So I was like, okay, so something's definitely wrong because you didn't biopsy the first time round. So she did a biopsy which took all of 10 minutes. That literally a 10-minute test. From there, she then walked me down to the mammogram and I was mammogrammed, which they didn't do the first time.
No.
And she actually sat me down in a room and told me there and then that I had breast cancer. And she acknowledged the fact that she had scanned me the year before and it had appeared normal. When I asked why the biopsy and the mammogram was not done the year before, it was because they're not standard procedure under 40 unless an abnormality is found on the scan. So, because my breast cancer the year before was in its early stages, it appeared normal.
So at this point, you know that you've got breast cancer.
Yeah.
So what happened then? So they put together a treatment plan?
I then left, being given an appointment to come back and see an oncologist and breast surgeon. Following week, I had a phone call to go up for a second biopsy, a deep core biopsy. So I returned, had that done, which is done under a mammogram. It was a very unpleasant experience, lots of just pushing and pulling and needles, and it was unpleasant. Following that, I was then called in to see the breast surgeon, where I was informed that my breast cancer wasn't as simple as they would like it to be, that it was extensively throughout the breast, not just the tumour, which by a year later of originally finding it was a 7cm tumour as opposed to a pea size, which had spread to my lymph nodes. So it was not going to be a simple cut out the tumour, do some radiotherapy, Charlie's fixed. It was now the plan of I needed chemotherapy, surgery and radiotherapy, and that my breast cancer was aggressive, was hormone negative, so lots of treatments wouldn't work for mine. And because it was such an aggressive form of cancer, I needed aggressive chemo.
And so at this point, they're just talking about breast cancer, not secondary breast cancer, not metastatic breast cancer.
No.
But
so that was the plan. I was having chemotherapy, then I was having a mastectomy, then I was having radiotherapy, and I was going to be fixed, and life was going to go on. What they do, because I'm assuming they do it with all breast cancer, but especially because mine is an aggressive form, they ordered full body and bone MRIs and CTs just as a precaution to make sure there was no spread. So my chemotherapy was booked, and then a few days later I had all these scans, and then I had a phone call to say that my chemotherapy had been put on hold as a shadow had been found in my liver.
Right.
at this point, I didn't really understand what that meant, having never heard of metastatic breast cancer, and also not knowing that if it had spread, that it was then incurable, and therefore I would die from it. I didn't understand that fully. So I've got this journey to fight, bring it on, hit me with it.
Yeah.
So I had to go for a PET scan, which I did, and the PET scan showed extensive tumours within my liver. So then everything became very different. So then all surgery was stopped.
So how did you find that out? So they'd done a full body scan.
Full body scan and a PET scan which focused solely on the liver, which I had to be radioactive for.
Okay. So did you go back to the hospital to get results of all of that, and that's when they go,
actually this is the situation. Yeah. Where they then explained to me that actually I couldn't be cured, so the breast surgery was no longer necessary because this wouldn't kill me. They needed to focus on trying to maintain the tumours in my liver.
So you sit in a room with a doctor and they tell you this can't be cured?
Yeah.
Okay.
And at that point it still didn't actually sink in.
No, that's quite big information to get.
It sunk in more for my husband. He was very tearful at the time, whereas I still sat there with my game face on of, that's fine, I've got this. And it wasn't until actually my chemotherapy started the following week that it hit me. So I went for my first round of chemotherapy, which the point of is not to cure, but to reduce the cancer, to prolong life. So rather than curing, it's prolong.
So all of the conversations, all the terminology changes really quickly.
Absolutely.
Then from cure through to, like say, to prolonging life.
Your targets are not get rid of cancer free. Your targets become milestones of time.
Yeah, that makes perfect sense. If at the point where you'd initially found that pea-sized lump, if they'd have done further investigation at that point in time, then this wouldn't be the route that you were on.
We wouldn't be sat here now.
We wouldn't be sat here talking.
No.
Because you'd have...
If they had done the biopsy as standard for any age, not just over 40, they would have known when it was that tiny, tiny little lump of cancer. They would have done surgery and radiotherapy at that point, a year and a half ago now. And at this point, I would be cancer-free and going about my very dull life as normal.
Okay.
If I had been 41 instead of 31, that test would have been done as standard. So if I'd known, in hindsight, if I had known now, I wouldn't have left that room without insisting that regardless of my age, because cancer doesn't care about age, and Jade Goody showed us that cancer does not care about age. So if I'd known then, I would have insisted that 2-minute biopsy was done there and then. So people who are under 40, women who are under 40, and men who are under 40 also, who find an abnormality within the breast, which doesn't just have to be a lump, it can be dimpling, it can be shrinkage of the breast, it can be changed shape of the breast. But if there is something that you're not sure about, and they say to you, oh, this scan is fine, you're only 31, you're only 35, insist that a biopsy is done, because the only way to 100% know is a biopsy, 2-minute test.
Okay, so you've had this crazy diagnosis, this like life-changing, life-ending, ultimately, diagnosis, and there's not just you to think about, there's your partner, there is your children. So what kind of support is there for all of you as a family unit when you get that kind of diagnosis?
Okay, the simple answer for that is none. So we have support emotionally and mentally from our friends and family around us, which has been great. But as far as professional help emotionally and mentally, there is organisations for myself. So I can myself contact Macmillan Sobel House, there is an organisation called Maggie's I can contact. I was referred for counselling, which is a specific cancer-related counselling, specifically tailored to terminal diagnosis cancer. That's all great, but my children and my husband, there is nothing on hand for them.
So you're almost having or needing counselling, not just for yourself, but because you are then that support for them, because
absolutely, yeah.
So like you didn't have enough to cope with the whole treatment and the diagnosis thing, you need to be also providing that support for your family, because it's not there. Not that they would feel like, oh, you should be supporting us, but just because as a mum, as a partner, that's exactly how you feel.
I genuinely feel that it is my responsibility to, as a mummy, to protect my children. So my children understand what's going on. My youngest, who's 3, he doesn't, but my daughter is 7, Erin. Alfie is nearly 9, and they fully understand that mummy has cancer, which is terrifying. It's terrifying for an adult to comprehend. For 2 small children, the word cancer is terrifying.
But also watching physical changes in you, seeing you go through, because the treatment has been brutal.
Really brutal,
You look amazing, hey, let's not forget. But the treatment has been brutal as you've been going through it.
The chemotherapy has been hard going, sometimes really hard. I went 2 weeks where I actually physically couldn't see my children because I couldn't look after them, and I was emotionally on the floor. And so that was upsetting for them, because all they wanted to do was be with me, and they couldn't.
And there's no support, there's nothing that steps in.
So I inquired, because my eldest, Alfie, he's found it really difficult, emotionally difficult. Knowing that mummy is going to die is frightening. So I inquired via my doctors, via my oncologist, the Maggie Centre, Sobel House, Macmillan, even the school, and the only organisation I was given for the children was an organisation called Cecil. They're bereavement counsellors for children, so I contacted them, but they only get involved with counselling children or supporting children of terminal cancer patients when you're at the time of end of life.
Oh, so you're not sick enough, darling, for your children to get that support.
I'm not near death enough at this time for my children to require support.
And actually, that's not on that charity that they don't do that. It's more that this should be. I don't even think it should be a charitable thing. It should be part of your care from the hospital. Part of your treatment, and everything should be supporting your family. Just because otherwise that burden falls on you. And like you've got enough to be dealing with.
I imagined as standard, when this journey began with the metastatic side of it, that as standard help would be provided to help get my children through it. Because yes, I'm not dying on my deathbed right at this moment in time, but my children and my husband have to get their heads around the fact that is a fact of the situation. They have to get their heads around the fact that the treatment makes me ill. All of that I then have to try and protect them from, but they are then trying to protect me at the same time. So none of us actually talk about it.
Right.
Me and my husband, we don't talk about it. We avoid that because he doesn't want to upset me. I don't want to upset him. We don't want to upset the children. So we all protect each other. Whereas what I assumed would be offered to us was an outlet to be able to get all of that out, either together as a family or individually. But that isn't there for any family. That's not unique to my situation.
It's just not how it is.
On my breast cancer, that is how it is. Support is given to the person with the diagnosis, to the point where my oncologist actually said to my husband in one of our settings that the help was focused on me because I was the person going through it, not him, which is not true. We're all going through it together.
Yeah, of course. Yeah.
This is our new norm now. This is our life and death now. And they have to just get on with it. 8 years old, 7 years old, 3 years old, and my husband, who are all going to be left behind when I'm gone, have to just get on with it.
And actually, at this point in time, they don't know how long that period of time
No.
is. So
no, it's
because
purely
you're still undergoing treatment, and so that's
purely based on how my body responds to treatment and for how long. It can change any time, but they will not be offered any emotional support until the time that it starts going horribly wrong. There's no preparation beforehand, and there's no support for the situation now. Because the situation now is that we have this diagnosis and we have to find our new norm.
Yeah, absolutely.
And live with cancer. There's no support to emotionally prepare them or enable them to live with cancer.
Okay. I just want to say thank you for coming in and doing this.
Thank you for having me.
It means an awful lot. And in terms of, we were talking earlier about breast cancer awareness and wearing pink and all the pink stuff that goes on, and how we know that people are just like aware of breast cancer.
Yeah, breast
it's not
cancer
like
is a word, everybody knows what it is.
Everybody knows what it is. But the difference between breast cancer and metastatic breast cancer and what it actually all means, I don't think people are aware of at all.
No, and I think people need to realise that when somebody has metastatic breast cancer, yes, it's horrific, and yes, we're going to die, but we are still who we were before.
Yeah.
Before being called cancer, we were Jane, Joe, Julie, Charlie, Anna. You know, we were people. We are still those people. And it's okay to carry on and treat us as those people. It doesn't all have to be about cancer. We're still people. And the other point I want to make is that if you find something that isn't normal, no matter how old you are, make sure that you push for every test possible to completely 100% rule out anything, because cancer doesn't care about age.
Okay. Thank you so much.
Thank you for having me.
Thanks.